All right, now a lot of folks are concerned that this public option ultimately becomes the only option and ultimately means the government is running everything. You have an alternative. What is it?
Absolutely. Well, let's start, first of all, across this country, I think the debate's over. I think the American people have spoken loudly. They've said they don't want a government-run plan that increases their taxes, that increases government spending across the country. Our people are worried that government is spending too much money only in Washington, D.C., where they respond by creating a plan that could spend $900 billion more dollars. Across the country, people are worried about jobs and the economy in the greatest recession since the Great Depression. Only in Washington, they respond by saying, let's raise taxes on employers and families. Across the country, our people are worried about the rising cost of health care, the unaffordability of health care. Only in Washington, they respond by proposing taxes on health insurance, on medical devices, on medical products. Look, the reality is the American people don't want this big Pelosi plan that government take over our health care, but there is an opportunity to get bipartisan reforms done. Nobody's defending the status quo. As Republicans, we can't just be the party of no. There's several things, if they would scrap these massive government plans, there's several things we could agree on in a bipartisan way. For example, let's make health insurance portable across jobs, across state lines. People are more mobile now, more than ever before. You shouldn't have to lose your coverage because you switch jobs or you move across state lines. Secondly, let's require insurance companies to cover pre-existing conditions. It makes no sense that it's harder to get insurance when you most need it, when you have a sick child, a sick relative, or you yourself get sick. Third, if we're serious about driving down the cost of health care, let's address the cost of defensive medicine. Frivolous lawsuits, one study says, could cost as much as $100 billion a year. I think it's telling. Neither of these plans really have significant reforms. Fourth, I agree with the president. Let's have electronic patient records that can drive down the cost of care, improve quality. Fifth, let's also reward people when they take actions like preventative health care, when they take care of themselves. Sixth, let's make tax savings accounts more available to more people so people can participate in buying their own health care in a tax-affordable way.